Hello, I am Johanna Tietze, a research assistant working with Dr. Soonhee on the DaCCoTA Community Collaborative on Translational Activity Scholar Awardee. I am recording this presentation on behalf of Dr. Soonhee and Yeon Shim Lee. This presentation is titled Cognitive Impairment and Social Determinants of Health Among Indigenous Women. Today's presentation is a supplemental data analysis using data from the 2021 project titled Intervention to Promote Breast Cancer Screening Among Indigenous Women. This study aimed to assess the levels of cognitive impairment and Alzheimer's disease, AD, knowledge among 123 Indigenous women aged 40 to 70 years in partnership with a tribe in the Northern Plains. The study used the Social Determinants of Health, SDOH, framework to examine the associations between selected SDOH factors and cognitive impairment status. For some background, the estimated number of people with AD and other dementias in the United States is predicted to more than double to 12.7 million by 2050 due to demographic factors such as population growth and aging. Cognitive impairment and Alzheimer's disease and related dementias, ADRD, are prevalent among Indigenous peoples, but research investigating these issues is limited. SDOH, such as poverty, education, housing, and access to healthcare, contribute to health disparities and increase the risk of developing ADRD. Historical trauma, cultural marginalization, and adverse childhood experiences further compound these inequities. The study used a community-based participatory research (CBPR) approach, which involved the formation of a community advisory board consisting of Indigenous community leaders, healthcare professionals who work with the Indigenous community, and social workers from social service agencies. The study employed a cross-sectional research design, and 123 participants were recruited from October 2021 through December 2021. Participants were recruited through various means, including tribal public radios, Facebook, local newspapers, flyers, referrals, and word of mouth. Cognitive impairment was measured using the Alzheimer's Disease 8, AD8 instrument. The AD8 is an 8-item interview to differentiate aging and dementia and is known as a brief and culturally sensitive instrument to detect the early signs of dementia. The SDOH variables considered in the analysis included education, health literacy, social engagement, religious activity and participation, depression, chronic conditions, and demographic information. Logistic regression to investigate the SDOH factors associated with cognitive impairment, education, dementia knowledge, social engagement, religious participation, depression, and chronic conditions were conducted using the AD8 instrument. Please refer to Table 2. In terms of results, the study showed that more than half of the respondents were likely to have cognitive impairment and had lower income and education levels compared to the group with normal cognition. Higher levels of AD knowledge in the treatment, management, and life impact of it were associated with lower odds of cognitive impairment. Conversely, higher levels of depression and participation in religious activities were associated with higher odds of cognitive impairment. In conclusion, future research should use culturally grounded tools or wellness instruments that are validated and appropriate for use with Indigenous populations. Additionally, it is worthwhile to focus on the unique risk and resilience factors associated with cognitive impairment, particularly in family caregivers and their coping process within Indigenous tribes. When historical and cultural factors are incorporated into SDOH frameworks tailored for Indigenous populations, it will lead to better health outcomes and ultimately enhancing AD-related dementia health equality.